Health and care challenges are complex, but what if we could tackle them together? Q Lab is part of Q, a diverse community made up of members from the front line of health and care to leadership. Q Lab brings together people from across the UK and Ireland to explore complex issues in health and care.
The experience with Q Lab has been a fantastic experience, actually. It's provided that opportunity, that time and space that we don't get working on the front line in healthcare. The Q Lab process, it's provided that credibility, so it's not just something you're fitting in, it's something that is respected. So that's an experience we've never had before, and that's what's allowed us to develop and work in this and achieve what we've achieved.
From the beginning, Q Lab has been a massive partner, really. Not only is it about some of the resourcing support, it's more about the journey that the team involved worked with us in a collaborative way.
We take quite a structured approach in the lab, bringing together design thinking, improvement and social innovation. And we do that through creating a really safe space for experimentation. We have quite a flexible approach with the teams that we work with, and we really focus on capacity and skills development to really support people to develop the skills for collaborative change that we think they need beyond their work in the lab.
I think Q Lab and Q Exchange were perfect opportunity for me to develop my leadership skills, to connect with fantastic colleagues and just keep learning really about new things, new approaches, new strategies, learning about ourselves through the coaching course, learning about different methodologies like the system thinking approach. All those workshops have been absolutely brilliant.
We're a small team, which means that we've got to be really quite conscious of time. We don't have a lot of time to spend on this really important work. So to have Q there as a sounding board for some of that, to streamline our processes and things, has been really valuable. I think what Q Lab helped us to do as a team was really focus on what was possible, certainly in phase one, where we came together without much experience of quality improvement. Allow us in a kind of structured way to learn a bit more about each other, a bit more about our skill mix, and then start to pick apart what it is that we really wanted to achieve and why, so really find that purpose. And then support us with the tools that we could use to try and get where we wanted to be, which very happily we did, of course, which is great.
We've worked on a number of priority issues that have always involved some level of collaboration that's needed from across the systems.
It's definitely been very positive having those connections, those links that we wouldn't have known about or been able to access before. Q helped find those people for us.
Running our project with Q Lab has been a lot easier than I think it would have been to not have any of their support. To try and do this in the NHS, which is under its own stresses, you just wouldn't have got, I don't think, the understanding for the reason of why we're wanting to do this. Whereas Q Lab were fully on board, they fully got us. And I think just really the positivity from the Q Lab team as well has been insightful and helpful for us to keep going at times when it's been really tough. I mean, we couldn't have done it without the support of the Q Lab.
Find out how the Q Lab can help you. Visit q.health.org.uk/QLab.